Live from the SABC headquarters in Auckland Park, Johannesburg. A very good evening to you and welcome to the Watchdog. I'm Peter Ndora, standing in for Vuyo Mvoko. He should be back on Monday. Now, men in Gauteng are reluctant to participate in the government's vaccination program. Numbers have revealed that fewer men were taking the vaccine for some reason. The province wants to launch a vaccination campaign focusing on men. Approximately 2.1 million vaccines have been administered in the province. And to help us unpack all of this, the voices that you're going to be hearing and faces you're going to be seeing, Dr. Nicholas Crisp, who's the Deputy Director General for the National Department of Health, and also Professor Jeffrey Mpahlele, who's the Deputy Vice Chancellor at the University of the Northwest. The Watchdog Show starts right now. Right, so on the program today we're unpacking what is it about men and not vaccinating. Is it government? Is it people? But it's quite clear that the majority of people taking the vaccination at the moment are women. But before we start unpacking all of that, let's get a sense of what the situation is like in terms of COVID-19. And we'll hear from Mr. Patla.
As we have seen in the first and the second wave, this is more like a relay race. As one province goes down in numbers, another province takes over. And in this case, the relay race has been picked up by the Western Cape, which is the current leader over the last 7 days. As we reported rising numbers even last week, it has now been steadily, continuously the highest daily infection, the highest active cases, and the highest also in hospitalization. But overall in the country, active cases have reduced by 7%. Hospital admissions have reduced by 4.4%. And therefore, there is a little bit of relief on the pressure on our hospitals.
So that's Dr. Patla there speaking a little bit earlier today. And so the situation is that COVID-19 is still with us, although it looks as if things have started to improve in terms of new cases, although sadly the numbers in the hospital are still quite significant, and it's moving around from province to province. It was Gauteng at first, at the beginning of this third wave, and then it moved to the Western Cape and then to KwaZulu-Natal. So that's the situation. But one of the contributing factors that we believe, and especially if you consider what's happening in other countries like the United States, statistics there show that the people that are getting sick the most there are the ones that are not vaccinated. For some reason here in South Africa, we're having issues in terms of people, vaccine hesitancy, but when you look at the numbers, men are more reluctant than women, and I wonder if there's something to that. Well, to help us unpack this, let's introduce our guests who are going to be helping us deal with this matter. I hope that Professor Mpahlele, thank you so much indeed for joining us. Welcome to you.
Thanks for having me, Peter.
All right, so is there a reason why men in particular wouldn't want to get vaccinated?
Well, the answer is that there's no biological reason why men are not just prioritizing their health. I think it's just in our mindset as men that we tend to procrastinate when it comes to health issues. It's not just about vaccines. Is the whole range of health-related issues. And no wonder why women tend to live a few years more than men, because they just look after their health.
How do we fix this? I mean, what do we do? I've just done a small survey here in the studio, and I've asked a few men what their thoughts are. And some, it seems as if it's fear. Some, it seems as if they're not quite sure. They're almost waiting to see what others do.
Yeah, so the reasons are wide-ranging. Clearly, fear is one of it. But if you think about the masculinity nature of men, I think we can rule out fear. I think it's very much about the mindset, as I mentioned, that we don't prioritize our health as men, and we just need to be educated. And the thing that we can do as men, and also for women to help us, is just to educate us about health, and not just when we are grown-up men, but it should start in childhood. So if you have got a son, you need to do the right education in terms of health. Just like we emphasize issues of, hesitancy, vaccine hesitancy, we need to emphasize why we need to prioritize our health with vaccination and with many other, health conditions, because we tend to wait until we feel that we can't take it anymore. Only then we want to see, the doctor, or we go to the health facility. But usually the damage is done by that time.
All right. Is it just education? I mean, I find it difficult to believe and understand these same parents take their babies for their jabs when they're born with a little a card, and they do that religiously. But for some reason we get to this one and suddenly there's debates.
Well, obviously, it's not all men. I think I will count myself as a man who tends to be serious about his health. But at the same time, I just neglect, myself. So, some men are really, really good at looking after themselves when it comes to health. They do all kinds of health checks on a regular basis, but others, unfortunately, don't do that. So we can't generalize. Not every man doesn't want to take health seriously, but at the same time, if you look at the statistics and the proportion of men who are not taking their health seriously, obviously, the proportion is higher than those who are taking, themselves seriously when it comes to health.
When I went to get my vaccination done, I got an appointment and I was directed to one site in northern Johannesburg. And I was given the time of 11 o'clock, and when I arrived there, there was a queue that literally was probably about 2 hours long. And I couldn't wait that long. And so luckily I was able to go to another location where the queues were shorter. But I guess this isn't an option for everybody. And is this maybe one of the contributing factors? And we're hoping to be able to speak to government a little bit later on. But, maybe women are more patient when it comes to queues, because I couldn't see myself standing around for 2 hours. And so I thought I'd rather drive around looking for another venue.
Well, it could be part of the reason. Clearly, you mentioned yourself as a good example for not being patient. But if you look at other health issues, Peter, you'll realize that we tend to just behave the same way. So it's not just something that is limited to vaccination. So I tend to believe that, yes, it could be that we are impatient, but at the same time, there must be another reason. And the reason for me is just something that is deep-seated in our behavior as men, because we just don't like to prioritize our health. So if we can just learn to be like women, when we have got problems, we go to the health facility, we see our doctors, I think that will do us great. But unfortunately, we're not doing that. And then it's becoming more obvious when we have got a crisis like the current pandemic, because we want to get more people vaccinated. And as long as men are not coming forward, unfortunately, this is threatening the vaccination coverage because it might take longer, to reach the target that the government would like to achieve with the vaccination, purely because it's not only, but it's primarily, women who are coming forward for vaccination.
Now, there isn't, unfortunately, a breakdown, perhaps, of race groups in terms of people not coming forward, men. But could there be a cultural aspect here, maybe superstition, that plays into the hesitancy?
Well, we know that when it comes to, reasons why people don't want to get vaccines, those reasons are, they vary, and it's not just about men, but perhaps men are very much concerned about what they see in the social media than women, and they tend to believe that perhaps is true. So I would like to believe that social media is contributing to vaccine hesitancy, and in fact we know, looking at the things that are circulating in social media, that it does play a significant role when it comes to vaccine hesitancy. So it could be that we as men, we tend to believe what we see and what we read in social media. And when women are exposed to the same risk, unfortunately, they are able to make a distinction between facts and fiction, and they still come forward to get their vaccines.
But yet we hear the statistics every day. Peter Ndoro will come up on the news and he'll say, these are the COVID statistics for today. So it's not as if it's happening in another world. We hear them. Are we saying that we just filter these numbers and these figures and act as if it will happen to someone else?
Correct, unfortunately. You should realize that there is this thinking that is really deep-rooted in many people's minds, that it's not going to happen to me. So even if you see the statistics every day, and it's very sad to see every day, that almost, half, at least 500,000 people, are perishing because of COVID-19. Yet, other people are still not serious about prevention strategies, even if we have got the vaccine. So clearly, yes, one can say that despite the facts, despite seeing the statistics on a daily basis, unfortunately, if you are an anti-vaxxer, if you don't believe in the benefits of vaccination, you're not going to change your mind. But if you are just hesitant, obviously you need to be persuaded. And we have seen that number of people who have been persuaded, they've changed their minds, they've changed their position, and they got the vaccines. However, there is still this other group of people who are not ready to take the vaccines, and they still believe in what they read in social media, and they still believe in the lies that they hear from other people, because it's not just about social media. It's what your friends tell you, is what the people that you mingle with tell you, and you tend to believe these things.
Yeah, I suppose that another route that we can take, and again, this is something that we're seeing in the United States, where they've tried to persuade people. They've even offered people money to go and get vaccinated, $100 to get vaccinated, which I think is about nearly 1,500 rand or so. But there's still some states that are not picking up, so they're not being incentivized with the carrot. Is it time, do you think, for us to maybe take out the stick now and start finding ways to pressure people to go and get vaccinated?
Well, you can't force, anyone to take the vaccine. There is this expression that says you can take the horse to the river, but you can't force it to drink water. So it applies to health issues as well. We can only persuade, we can educate, and in some cases, obviously depending on the risk level, obviously people should be vaccinated. If they are not vaccinated, they should know that they might have to be shifted, to other positions at the workplaces, which are less risky if they are available. Unfortunately, these positions are not going to be available to everybody. So the key thing here is that unless you really have genuine reasons not to get the vaccine, you shouldn't maybe think about vaccination. If you have got health, reasons why you shouldn't get the vaccine, and obviously it means that you would have discussed these issues with your health doctor. People would know that you are perhaps severely allergic to, or maybe you have been severely allergic to the first dose of the vaccine or something like that. Then you can probably think about not taking the second dose, but after discussing with the health doctor, with your doctor. But other than that, people should really think seriously about taking the vaccines because the vaccines are safe. If you do get mild reactions, if you get reactions, usually these reactions are very mild by and large. So we need to persuade people to get the vaccines because generally the vaccines are safe.
Yeah, you say that we should have a choice, and in an ideal world that's a great thing, but lives are being lost. The United States again have also enhanced some of their policies where in federal buildings, government buildings, certain conditions must apply, and they're also almost forcing government employees who are public facing to get vaccinated. Kenya is doing the same as well, saying all public servants have to get vaccinated, partly because they are public facing. Is there no merit to that in certain areas that government can control, government buildings, public servants that are public facing should be vaccinated?
Absolutely. So there is a case here that you can make vaccine mandatory in certain instances. But as I said, unless somebody has got a genuine reason and perhaps a health reason for not being vaccinated, that person might be looked at differently. Otherwise, we need to get the vaccines. And we should make them mandatory to a certain extent, especially for those people who are at risk of exposure. And of course, we know that if you are exposed to COVID-19 and you get serious disease, severe disease of COVID-19, you will end up in the hospital and you might even die, from the disease. So I think these are really good reasons why people should really cooperate at the workplaces and get the vaccines. So I really think that the employers who are advocating for vaccines, they are doing the right things for their employees because we should get the vaccines. Ideally, all of us should get the vaccines, but we know that in real world, that is not the case. But we don't want the situation where people who are vaccinated are still exposed to the risk because the majority of people choose not to be vaccinated.
All right, so we're going to take a quick break, and I'm hoping that after the break we'll be able to start to get some views from our callers to get a sense of what they might be thinking. So let's put up that number on your screen that we want you to call if you want to participate and get your thoughts on the program. Have we got the number? All right, so that's the number there. Please call that number. Johannesburg 714-5958 and 5877. So get your dials. Do you know why some people, your friends, are not vaccinating? Is there a reason that they've given you? Is there a reason why you're not vaccinating? We'd love to hear from you. Let's have a chat, let's have a conversation about this problem, because one of the ways of stopping this pandemic is to get as many people vaccinated as possible. Initially, we had an issue in terms of vaccine availability, but that no longer is the case. The vaccines are coming in, and the sites are there, they're available, you can register, but for some reason, some people still are not getting vaccinated. Let's have a chat about that, and let's see what we can do going forward. All of that still to come after the break. Welcome back. You are watching The Watchdog, and today we're trying to explore the reasons why some people are not vaccinating. But in particular, it seems that men are the most reluctant. Women, by far and away, are the ones that are stepping forward and getting these vaccines. And we're speaking to Professor Jeffrey Mpatlele, and he was offering some reasons why there might be reluctance. And part of that is that men generally, for some reason, don't take care of their health as much as women do. All right, let's start to get a sense from you at home, what your thoughts are, and some of the reasons that your friends are giving you, and maybe what we can do about it. And let's start with Gift. Hello, Gift. Thanks so much indeed for joining us. Welcome to the program. Hello, Gift. Are you there?
Hi, Peter. Yes, I'm there.
Right. Have you been vaccinated, Gift?
Yes, I just got vaccinated yesterday. My first dose, yes.
All right. Why did you get vaccinated?
You know, I think as a man, all men must lead by example to show the whole country that we are real serious about defeating this disease. All men must lead by example, be the first people to be vaccinated, so that our kids and women who are scared, they can see that, okay, this is real. And they will also follow. Because if we don't do so, definitely everybody is going to be reluctant. And then this thing won't end. It will continue bothering people.
What have your friends been telling you? Do you have friends who perhaps are reluctant to come forward?
Yes, I've got a number of friends, but yes, some are changing their minds, some are getting vaccinated, but most people do not have the information, the right information. People are depending on the social media, and they are getting wrong information. At the end of the day, it's causing problems. Because the information that you get on social media, it's somebody who is seated at home, whatever comes up in his own or her mind, he just puts it in air. And everybody takes that seriously.
And what are some of the things that are being said on social media that's putting people off?
Most people are saying we don't know what's going to happen in the near future about these vaccines. Maybe we're going to be affected or something is going to happen because the time frame for making those vaccines was too short. No, but like usually vaccines take 10 to 15 years to be produced. These ones, within a short period of time, they are available. You know, people are skeptical. They don't know what's really going on.
All right. Gift, thanks so much indeed for coming through and sharing your thoughts with us. Let's hear from Paul. I believe you're in Cape Town. Paul, thanks very much indeed for joining us. Have you been vaccinated, Paul?
No, I haven't, Peter.
Are you going?
Not. I do not have the intentions of going, Peter.
Tell me why.
I don't think that the government has been forthcoming with information, nor the authorities. We've had scientists from across the world promoting drugs like ivermectin, and we've seen a situation where a vaccine is released overnight, and but more studies are required for ivermectin, things like ivermectin.
All right, so you're talking about treatment here, but vaccines are about prevention. I don't know if this statistic will help you, but in the United States, they've said that as much as 90 to 95% of the people who are now getting hospitalized and now getting sick from COVID-19 are those that haven't been vaccinated, and that the 5%, 10% are people who are vaccinated. Does that help you make up your mind?
But other people I know and they passed away.
All right, so you're not convinced. All right, Paul.
I'm not convinced, and I'm also not convinced about the openness of world authorities on things, because we've got a scientist called Dr. Pierre Corey, and he's a scientist, and he's promoted ivermectin, and he's basically his stance is that ivermectin as a prophylaxis and also as a treatment drug that inhibits the viral load in somebody's body. But in this country, we are blocking ivermectin, which is...
Or what else would you like government to tell you? Because you started off by saying that government isn't giving you all the information that you need. What's missing? All right, that was Paul in Cape Town. It looks like we've lost him, but he's determined that he's not going to get vaccinated. He's heard about these treatments such as ivermectin, and the official word on that is that it can be useful, but it's for certain patients with a certain degree of illness, and it's not working with everybody. And so it is a treatment, but it certainly isn't. Prevention is certainly better than cure, one would think, and that's what the vaccine is about. And obviously we're trying to get to this herd immunity levels, but that's not going to happen. All right, I think we've got another caller, is that correct? Skumbuzo, thanks very much indeed. I believe you're in Durban. Have you been vaccinated, Skumbuzo?
Not vaccinated.
Are you going to get vaccinated?
I'm not going to be vaccinated.
Why are you reluctant to get vaccinated, Skumbuzo?
I'm not even reluctant. I've just made a position. I took a position not to get vaccinated because there's no fairness in the whole thing of the coronavirus, COVID-19. I believe we are so many. As the people who are skeptical about what is going on with the coronavirus come around, there are people like myself and others who are not represented. There is a lot that is said to be fake news on the news, but nobody is representing those voices. it's all about fake news. But if you go through, you can see there's a lot, to desire in whatever the people are saying. Now, it is very much unfair to just turn a blind eye on things that even make sense. Nobody explores, in the public. It's like everybody is pushed to believe. And you can even, there's a lot that makes sense that is against the whole thing, but nobody represents those voices. That is why then, in fact, a lot that we hear and we see, we even examine ourselves, makes us take this stand that, oh no, we are not going to be vaccinated. I strongly believe somehow that there is something else, not the corona, not the virus. There is something else here. That is why I'm not going to be vaccinated, because my belief is that thing that I suspect has got, the vaccine has something to do with it as well. It's like I don't know what I'm getting myself into if I get vaccinated.
So I'm just trying to get through the way you ended up with this conclusion. So you woke up one morning and you started to hear messages from various people, some on the internet, some on social media, and then you've got government. That is, their responsibility is to look after citizens. Government says this is the science, that coronavirus, this is what it looks like, and we now have vaccines that can deal with coronavirus. Let's get vaccinated. Are you saying that government, you don't trust government and the message that they're giving you?
Yes, I don't trust the government. I don't trust the government because, like I'm saying, what about the people who have come out, they are trying their best just to have another side publicized as well, so that we can go out there, get vaccinated, all of us knowing, that, okay, these are the people who are skeptical, but they are wrong for being skeptical based on this and that. They're just opposed with what they are saying, Now, if none of the things that other people are saying is given to us, as the public, it's only this one side, and the way the vaccines are produced, to me, it's like every country that makes vaccines, they are going to come to South Africa. That's one thing that it makes me like, what is this? Every country that generates vaccine, it will come to South Africa, to Africa. Now, to me, it's like, I really don't know. It looks like there's more to it than just getting vaccinated.
Are you a father?
Yes, I am.
How old?
And in fact, that's why I'm taking it. It's like I have a responsibility to make sure, that whatever I would teach my children, I teach them not to take things without questioning if there is something around them.
Did you get your kids vaccinated?
No.
No, not against...
as children, for
yes.
For the things that, those. Yes, I did get them vaccinated.
So why did you trust government then and not now?
That was not the coronavirus. I know why those. That was not the coronavirus. There was no the diseases that they are prevented when the kids are vaccinated are the diseases that existed. They were proven. Coronavirus has not been proven. The governments of states are not willing to prove to us that the virus exists. Now, why should we we are forced to just believe it? Whether it's there or not, we just have to believe it. It's not proven. We only see people dying. We even develop theories. We are given platform to develop theories as to why people die.
Okay. I mean, the information is out there, but clearly you're not believing it. But thanks so much indeed for joining us, Kumbuza, sharing your thoughts with us, because there are a number of people who think the same way. In fact, let's listen to a few that we went out on the streets to find out what their thoughts were. Some choosing to be vaccinated and others not. This is what they said.
I got vaccinated. You know why? Because I love my country. Because I love those who are close to me. I love my family. I love my friends. And I'm in the entertainment industry. I would love to go back to normal life.
If you have a testing protocol that's not accurate, and then you have people going into hospital who've maybe got TB but are being wrongly tested to say they've got COVID and then put on a ventilator, it could kill them. You know, I'm not a doctor, but it's really, this is a basic thing.
We don't want to be subjected to curfews, we don't want to be subjected to wearing masks, and we definitely don't want to be subjected to any narrative that is going along the lines of forced vaccines to enter into public spaces.
The reason why I went for vaccination was to protect my family, to protect myself and all those around me, especially at work, and also to try and minimize the chances of me being in hospital.
Only thing they say is vaccine, 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 vaccine. We want other options, President. Please, let's open up our industries. We want to work. We are DJs.
Welcome back. You're watching The Watchdog, and today we're trying to unpack why there's vaccine hesitancy, and in particular why it's happening with men. And we certainly got a number of callers coming through, and let me say there were men, and the ones that were hesitant were saying all number of reasons, and one gets a sense that there's a lot of information out there. Some of it is not genuine, some of it they don't understand, and as a result there is this confusion, I suspect, about what the information means, and people are persuading each other perhaps too quickly. Let's go back to Professor Jeffrey Mphahlele, who's been talking to us during the course of this conversation. Prof, what did you make of what you heard from our callers and also from the clip that we showed our viewers just now?
The reasons are very much familiar, and is exactly what is circulating in social media, and is what is circulating amongst people in general, the public, because it's all about lack of trust of the scientific information, a lack of trust of maybe what the government is communicating. There is conspiracy theories that the government and probably the people who are making vaccines have got another agenda with the world population, and so many reasons. As I said, these reasons are wide-ranging. So the other thing that I picked up is the fact that it looks like people who are still hesitant, who still have questions, they like to have a space and a public space where they can debate the issues. And if that can help, I think they should be given a space to debate the issues, because the minute we know what the issues are, we will be able to tackle the issues, design solutions to address the issues, and hopefully we can find each other ultimately. Then the other thing that was mentioned, and I think is important in the scientific community, is the fact that we tend to perhaps talk across each other as scientists, and for many reasons. I know that if you're in academia, freedom of speech is given, and people should express themselves as they wish. However, I think we need to do it in a responsible way as well, because if we are contradicting each other to the extent where the public becomes confused, I think we're creating a problem. And we're just fueling the vaccine hesitancy as well. So, yes, I think there are reasons which have been mentioned, and I believe that we can address them as the scientific community, and we just need to hear more about these reasons so that we can come up with solutions to address them.
The Ministry of Health, the Department of Health, should be the final word in terms of health matters where there's confusion. I mean, it should be that if you want information about health issues, I should be able to go to my government website, and that should be all that I need to know. I don't need to check anybody else or whatever. But it does seem that there's a trust deficit. Now, whose fault is that? That you've got people who can categorically say, I don't trust government.
Yeah, that is a challenge because it's not that information is not there. Perhaps there is some kind of information which is lacking, and it can only come out when people are given space to debate. So whatever the government is communicating through the web sites, through pamphlets, billboards, and all public spaces where they can do advertises, where they could advertise and share information. Maybe that is not enough. I think what is really critical is engagement, because it looks like the people feel that they would like to debate issues. However, there is no space to debate these issues. I like to believe that maybe the communication from government is not optimal, but there is plenty of information. The only thing is that people tend to be selective when it comes to information. Why there is so much consumption of information from social media, but people don't consume information from Department of Health websites and many other health websites, the World Health Organization, and many other websites. Why do we choose to really go for the websites which, not even websites, social media, and knowing that social media is not really a scientific information. So that is really mind-boggling.
All right. Well, let's get some explanation or thoughts from government. We're now joined by the Deputy Director General, Department of Health, Dr. Nicholas Crisp. Thanks very much indeed for joining us, and welcome to the program.
Evening, and I'm sorry I'm a bit late into the program. Nice to hear Professor Mphahlele, and nice to talk to your viewers.
All right, so I don't know, do you have an explanation maybe why we have men in particular sort of hesitant to go and get vaccinated much more than women for some reason?
Well, I suppose it's strange having three men here talking about men's issues, and we should be criticizing ourselves. So, I mean, I have a personal theory, but I don't think I've got much to back it up. And that is that women engage with the health system from the time that they are small children, then they get pregnant and have their own children, and during their antenatal visits, during their taking of their children for vaccinations, during their own care, they are familiar and they are the carers in the family. So my experience in working in the years of clinical practice was that women engage quite readily with the health system, and they are always there, they're always caring. Men, on the other hand, first of all, we are very tardy to recognize when we have problems. We put things off until they are serious problems. Then we still deny them. And we wonder why we don't get cared for properly, or that things go wrong in our lives. It's a very strange phenomenon, but it's my observations of men are just not engaged in the health system. But it's not an excuse. We get sick like everybody else. We need preventive health care like everybody else. And we are supposed to be also contributing to our families, raising our children, and participating in our work and society. So we should be the ones who are engaging. And right now, if we carry on with the way that we, and I regard myself amongst the men, don't look after ourselves, we are going to end up being the ones who are sick at Christmas time. We will take our illness back to our homes when it's Christmas break, and we are in the middle of a potential fourth wave, and we won't do the country or ourselves or our families any favors at all. So I would really like to appeal. This is not the time to shy away from vaccination. We know vaccination works. We know vaccines are safe. And we just don't have an excuse. We need to make arrangements to get away from work if the work is the challenge. And we need to encourage one another and get vaccinated as men and catch up with the women who've done very well so far.
There is a sense that people don't trust government, that people either are not hearing your message or understanding it. But how do we explain this trust deficit? Is there a better way that you can communicate? Because there are a lot of people out there that are getting messages from everywhere else except from you.
Well, yeah, look, I think we acknowledge that there's a trust deficit with government generally. But as health professionals, we are still health professionals, even those who work in the government or in parastatals or related to the government. We are still doctors, and we are health professionals. And it's important that we continue to communicate the truth. We continue to communicate in language that is easy to understand, because unfortunately we do tend to use big words sometimes and confuse people. But I heard the comment earlier by Prof. Mpatlele talking about why do people go to social media and gossip stories and not get the real story, whether it's from government or whether it's from health professionals who can be trusted. It's quite strange that people want to listen to rumors instead of listening to fact. I'm sure there's lots more we can do to communicate better.
All right, so how do we move forward? Because people are saying, look, there's ivermectin, there are a lot of other treatments, and government is not explaining it to us. How do we put to bed all of these issues and tell the story of what vaccines will do for not just individuals but society in general?
So I think that the evidence must speak. And I was reading a few stories this morning of a woman who, first of all, a woman who had not wanted to be vaccinated, and she went to visit family and she got desperately ill and was hospitalized. And she said she prayed the whole time she was in hospital that she would come out alive and get vaccinated and tell other people to vaccinate. The next story I read was another person who had not been vaccinated and who had nearly died and wished they'd been vaccinated. Then there was a story about somebody whose loved one did die, and the social media said that it was as a result of the vaccination, and that person had never been vaccinated, had not even registered for vaccination yet, but somebody else not related to the story had put the message out there. People are dying from exposure to the vaccine, exposure to the disease, and not being vaccinated. And then people are being vaccinated, and we can see that healthcare workers who have been vaccinated are not getting sick, and they are being able to look after the people who are sick and dying. So for me, the evidence is there, and we need to encourage people who have been working in the health system or who have been patients in the health system to tell their testimony. Because the public wants to hear from people who are real-life people, and not, quite frankly, people like me who are working in government, even if I am a doctor and I have some credibility in the health space. They want to hear from people that they engage with at a personal level and can understand those personal stories. So we would encourage people to share their stories.
All right. As we wrap up, I'm going to give a final word to Professor Mpatlele just now, but if you could just debunk a few issues. Will I get sick from getting the vaccination?
Well, many people get small side effects. You get a sore arm, you might get a little bit of a cold, you might feel a little bit uncomfortable for a day, but within 24 to 48 hours, you will feel yourself again. That is the majority of people feel nothing or that's at the worst. And I'm speaking from someone who's been vaccinated, so I know that is what I didn't feel so great the next day. It was an afternoon I was vaccinated, and I didn't feel myself the next day. But the day after that, I was fine. So you might feel uncomfortable for a while as your body makes immunity to the vaccine that you've been exposed to. But that's it. But boy, if you get COVID, you're going to know all about it, especially if you're an older person, because it really hammers you. And it can make you so sick that you end up in hospital and you may even die.
So the vaccine doesn't stop you getting COVID, but it stops you getting very ill. Is that the story?
Yes. So the vaccine, one dose of Pfizer vaccine will stop you from getting severely ill, but it may not stop mild illness. 2 doses of Pfizer, it will cover you that it will be very rare that you would even get sick if you're exposed to the virus. And 1 dose of Johnson & Johnson is sufficient to protect you from both mild illness and from severe illness. Some of us may not make enough immunity and may get mildly ill. But if you are vaccinated, your chances of getting severely ill are extremely reduced.
Okay. Dr. Nicholas Crisp, Deputy Director General, National Department of Health, thank you very much indeed for joining us. And Professor Mphahlele, perhaps a final word to our men folk in particular, but South Africa in general, about vaccination.
Look, Peter, vaccination saves lives. And even if we don't have to talk about vaccination against SARS-CoV-2, the history shows that vaccination saves lives. We have got so many life-saving vaccines, from polio, smallpox, hepatitis B. You can give the whole list of vaccines. And COVID-19 vaccines are not different. We hear what people are saying in terms of the time frame for developing these vaccines. What they forget is that during old days, based on the old technology that was in use, it took many, many years to develop the vaccine. But with the current technology, that time frame has been narrowed significantly.
Okay.
So that does not mean that the vaccines are not safe, because even after that, they are being tested in animals, they are tested in human beings, and they are shown to be safe and to be efficacious. So men in general should take vaccines seriously, and they should take their health as priority number one. So they should love themselves like they love their best pets at home.
Thank you so much indeed for joining us and sharing some pearls of wisdom there. Let's hope that everybody is listening. Thank you so much to both of you, my guests. Thank you for your time.
Thank you.
All right. And that's where we come to the end of Watchdog today. Please don't mess about with this thing. COVID is real, and getting vaccinated can significantly, and we've just heard that from Dr. Crisp, you won't get as ill if you do get ill at all if you get vaccinated. So follow all the protocols and get your vaccination as soon as you can. Please wear a mask. Bye-bye.